question hour, let us take up the question number 36, raised by Srimati Miani Disira, MLA. Minister in charge to reply, please.
Honorable Speaker, sir. Reply to start question 36, sir. A. So the number of JE or Japanese Encephalitis cases detected is 89 numbers in 2023-24 and 147 numbers in 24-25. The district-wise number of JE cases detected in the state of Meghalaya: East Khasi Hills 23-24, 10, West Khasi Hills 5, West Jingkylla Hills 34, Ribhoi District 25, West East South Garo Hills 0, Southwest Khasi Hills 5, East Jingkylla Hills 5, Southwest Garo Hills 2, North Garo Hills 0, East West Khasi Hills 3. In the year April to March 24-25, East Khasi Hills 29, West Khasi Hills 5, West Jingkylla Hills 49, Ribhoi District 25, West Garo Hills and East Garo Hills 0, South Garo Hills 1, Southwest Khasi Hills 1, East Jingkylla Hills 22, Southwest Garo Hills 2, North Garo Hills 0, Eastern West Khasi Hills 10. Sir, B. Steps are taken by the government to fight the disease as per statement placed on the table of the House, sir.
You may seek your...
Thank you, Mr. Speaker, sir. I want to thank the Honourable Minister for the reply. Mr. Speaker, sir, may I know from the Honourable Minister the number of confirmed deaths due to JE in the past 2 years?
Honourable Speaker, sir, district-wise number of JE death cases. April to December 23, nil. JE death cases April to December 24, 15. JE death cases April to December 25, 3.
Mr. Speaker, sir, we can see from the reply of the Honourable Minister that the cases has been increasing every year, and the death is also quite a number. So therefore, sir, may I know from the Honourable Minister whether the government is planning to have a vaccination drive for senior citizens and encourage young adults to get themselves vaccinated, because I can see from the Honourable Minister's reply in point B that vaccination with the routine immunization program is being done. So for the senior citizens and for the young adults, whether the government is planning to have a vaccination drive.
Honourable Speaker, sir, this vaccine, sir, was introduced as the Universal Immunization Program by Government of India in 2015. Status of coverage of immunization. In Eastern West Khasi Hills, it's at 79%. East Garo Hills, it's at 80%. East Jingkylla Hills, it's at 98%. East Khasi Hills, it's at 71%. North Garo Hills, it's at 84%. Ribhoi, it's at 82%. South Garo Hills, it's at 92%. Southwest Garo Hills, it's at 93%. Southwest Khasi Hills, it's at 74%. West Garo Hills, it's at 95%. West Jingkylla Hills, it's at 90%. West Khasi Hills, it's at 77%. This is inclusive of the first dose as well as the second dose of the vaccine. If you notice, though I have just read it around, allowed, the percentages where incidences of JE is higher, there has been an extensive, widespread awareness. Hence, you see that percentages of coverage of vaccination is much higher as compared to areas where incidence is nil or not a threat.
Mr. Speaker, sir, actually, I wanted to know from the Honorable Minister, vaccination drive for senior citizens and young adults.
Sir, the actual JE vaccine is part of the universal immunization program for 9 to 11 months and 16 to 23 months. Now, when we look at the age groups of JE occurrence, we do notice that the largest number is for infants. And because this program was only introduced in 2015, wherever there is high prevalence of mosquito, we recommend for universal coverage.
Mr. Speaker, sir, we know that in our neighboring state Assam, there are very high number of cases for JE, and the number of confirmed deaths due to JE is also very high. Therefore, sir, I thank the Honorable Minister. We have a very high coverage of vaccination in almost all the districts, and as we all know, the most vulnerable to the diseases are infants and senior citizens. But for the infants, as we all know, it is being covered under the universal immunization. However, I'd just like to make a suggestion to the Honorable Minister that within the community, I think the information about this disease is quite low. And when patients having symptoms of JE are reported, because the initial symptom is just fever, and then only later on the hallucinations and the other symptoms tend to show. So within the community, there is lack of awareness. So whether the government is planning to have awareness programs for the citizens.
Honorable Speaker, like every virus, community awareness and IEC activities have proven to be very, very successful. And yes, intersectoral meetings between different departments, different districts are already being mobilized, especially in the high vulnerable areas. We are also now, sir, in the process of sensitizing even officials of the veterinary department, because there we have seen that veterinary officials also have to understand and be a part of the entomological surveillance and vector control. There has to be this coordination. Ashas now, sir, are also going to be included in this awareness creation. And in fact, we are scheduling the Asha program this month or the coming month so that we can involve them, sir. Sir, one of the greatest challenges for the rise in JE obviously is climatic change. So we are on the job, sir, and there is a very targeted intervention by the government of Meghalaya to ensure that even under climate change, we have components of interventions which are going to be effective overall.
Your last question.
Sir, last question. Mr. Speaker, sir, may I know, not a question really, but a suggestion rather, that if the government can advise the medical fraternity to be on high alert, because this disease is spreading very rapidly, unexpectedly. We can see that in all the districts it's increasing, and in few of the districts we can see the cases are nil, but I'm sure it's not nil. So if the medical fraternity can be on high alert to test this and be on the lookout for the symptoms of this disease. So this is my humble submission. Thank you, sir.
Point noted, sir.
Thank you. Dr. Mizanur Khaji, please.